information regarding how we'll run our hybrid meeting in person and on Zoom during this time of social distancing. Each action item will have an opportunity for public comment. If you want to make a comment on the item, we ask that you wait until that item on the agenda. The general public comment portion of our agenda is for items that are not on the agenda, but related to general county business. All comments should be directed to the County Commission. For both opportunities, we will take public comment from folks who are in person at the courthouse first, then online commenters. All public comment will be limited to 3 minutes. If you have public comment on an agenda item or under general public comment, please use the raise your hand function if joining us on Zoom. Staff will call on you and move you into the meeting, and you will be able to unmute. We ask that each speaker give their name and address for the minutes. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. If visual aids are used during the meeting, the presenter will share their screen with the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be able to unmute when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking, and introduce themselves each time they speak. A recording of this meeting will be available on our website after the meeting. Our first item for today is to continue the discussion that we tabled last week of chair and vice chair roles on the commission. Last week, we decided to table this conversation until today. In part, that was because we wanted to be sure to have the space to really discuss the history and goal of these roles and how we might discuss them moving forward with a potential change to a 5-member commission. Sarah, I believe you were going to share a bit more about the history of these roles and how this has worked in the county in the past.
Yes, thanks, commissioners. And just as a brief bit of background, in my 10 years here, in terms of how we handled chair and vice chair, there is not a set formal process or procedure for how that rotates and changes. There have been generally it rotates between the membership with sort of from commissioner to commissioner to commissioner. However, there have been variations from that at time to time based off of what that commission asked for at the time. I'd say most of those cases, it was when someone declined to want to take that, maybe they felt like they couldn't handle the position of chair or vice chair at the time. That is a really good segue into what are the roles of the chair and vice chair, and maybe just to clarify some things for the public and people that might have questions about that responsibility. In our form of government, with the commissioners each representing different districts, our chair has no more authority or power than any other commissioner. Their main responsibility is to conduct the meeting and lead and facilitate the meeting. There are some documents that only the chair's signature is required, and specifically, probably most of those revolve around emergency orders of some sort. The most recent one would be an emergency health order. And really that is the chair could authorize that until the next regularly scheduled meeting of the county commission. So, I'd also say we've done that with some burn bans and some fire related emergency service work as well. So it is really that sort of initial first contact for some things as a representative, but there really is no more, the agenda is set by staff. I set that agenda until this meeting. When it is handed over to the commission can make adjustments to that. So I hope that clarifies maybe for some folks that might just not know that much about how our process has gone and as to how things rotate. And just if there are other comments or questions that commissioners might have of me in that process, I'd be glad to share.
Thank you for that history and background, Sarah. I think that part of the conversation moving forward is, if we do expand to a 5-member commission, do we want to continue the way things have gone? Do we want to have that as part of our conversation for potential expansion? And I imagine that we will have that as we continue to talk about putting it to a vote of whether we want to move to 5 members, and if that vote moves forward, then what that might look like as the commission reorganizes itself moving forward with more members. But with our current members, I am happy to make a motion to see Vice Chair Commissioner Reed move into the role of chair and Commissioner Kelly to hopefully take on the role of vice chair. I'm excited to see the leadership of the commission under Commissioner Reed in this coming year. So I move to have Commissioner Reed as chair and Commissioner Kelly as vice chair.
Second.
All of those in favor, please say aye.
Aye.
Aye. Shannon, I'll hand the meeting over to you.
Thank you. This is Commissioner Reed here. Thanks, Commissioner Portillo, for bringing up that point for a bit of discussion and history. And thanks, Sarah, for some context. I do think that as staff work to bring more information back to us in the future about the 5-member commission, that's a kind of a point of research, perhaps among other 5-member commissions within the state and what their practices for selecting that might be. With that, we will move on to tonight's consent agenda. Do either of my fellow commissioners want to remove anything or discuss anything on the consent agenda?
No.
Is there anybody in the public? I'll start with the commission room that would like to remove anything from the consent agenda for further discussion. Seeing none, I'll ask if there's anybody on Zoom who's joining us. Let's raise our hands. Thanks, Jill. Looking for a motion.
Make a motion to approve the consent agenda items 1, 2, 3, 4, and 5.
I second.
All those in favor?
Aye.
Aye.
Okay, moving on to item 3. It's our general public comment. As mentioned before, this is a time for public comment about anything that is not on this evening's regular agenda item. Is there anybody in the commission room who would like to make general public comment? Seeing none. Jill, do you see anybody with their hand raised online? Okay, thanks. We'll close general public comment and move on to a regular agenda item 4.1. Which is a continued discussion with community partner Heartland Community Health Center. And Sarah, would you like to provide some information first?
Sure. Commissioners representative Heartland Health Center are here. Julie Brandstrom and Rachel Hartford, amongst others, are here from Heartland Health to continue back this discussion that we had earlier this year about the budget allocation for Heartland Health. I don't know, Julie, if you want to come forward and the commissioners might have some questions, or if there's anything you'd like to present.
All right. Thank you so much to the commissioners for allowing us an opportunity to come back and to request reconsideration of our allocation for Heartland. I've only been I'm in my 3rd week now as CEO, and I just wanted to reassure you that it's been longer than just these past 3 weeks that Heartland has been working to reestablish a trustworthy process and re-engage with our community partners. And I think that we have been really successful in doing so. As you know, we provided a written narrative and report with some attachments that hopefully answer any questions that you might have of us tonight, but we also are happy to answer additional questions if you have them. I think I just want you to understand that the community's investment in Heartland directly affects access to care for the most vulnerable people in our community. And so this is a really important time in the middle of a pandemic to consider making that investment in healthcare. I do have Rachel Hartford and Lisa Russell. Rachel is our Chief Operations Officer, and Lisa Russell is our Chief Clinical Officer. And they're here also to help answer questions that you might have of us. So would just ask whether or not you've got questions, and we'll be happy to discuss.
Thank you for joining us again, and thanks for that. Is Commissioner Reed here? Do my fellow commissioners have any questions?
This is Commissioner Portillo. As Commissioner Reed mentioned, thank you for joining us. I really appreciate the written document and the additional background information. I just wanted to talk a bit more and hear a bit more from you. We've heard some requests from the community to potentially have a board member from the county. I don't know that this necessarily needs to be a board member, but potentially just someone ex officio from our staff coming to be a part of the conversations with the board. Can you tell me a bit more about how that might work or what might not work, and your thoughts about the role of the county as potentially being a part of that board in an ex officio kind of way?
Sure. I think the most important thing to understand about Heartland's board is that it's a requirement that 51% of our board composition has to be made up of consumers of the health center. And so that's the first thing that we always consider as we are looking to add additional board members or replace board members that might be rotating off. And I think the remainder of the board seats, we typically are just looking for people in our community who can bring expertise and also just represent the community at large. So I think that's absolutely something we could consider. We're actually right now at a time when we are looking to replace a couple of board members that are rotating off. And so I think that could absolutely be a conversation that we could continue beyond tonight.
Well, and help me understand, is that 51% requirement voting members or all members?
All members.
Okay, thank you.
And all members vote. So sorry for that. I probably need to clarify that. So staff don't vote, but all board members have a vote.
So just help me, Julie, understand the boards. Like, we have an ex officio member on the Lawrence Community Shelters Board.
Mhm.
That person doesn't vote. They go to all those meetings. They are a liaison to us since there's significant dollars that come from the community. And because, quite frankly, we've had concerns before about that. You would think that it sounds like you're saying you don't think an ex officio member, someone who doesn't vote, is not something that you can do.
Well, I'm not saying that we can't do that.
Okay.
That's not something we have done historically. That's certainly something we could look into. I'm not sure what our federal requirements would be around that, but I would be happy to investigate that and get an answer to that question.
Yeah, and just to follow up, because I think that was something we were pretty clear about last time we spoke, that was something we'd like to have happen. So if you're gonna just follow up on it, how do we, what's the follow up to us on that in terms of progress made on that? Or are there other accommodations that could be made where a member of the county attends, it doesn't vote, but is allowed to attend board meetings? You know, would that be possible and allowed to provide feedback and contributions to the meeting without being, because our intent was not to be a voting board member. The recommendation was to have someone attend and make
Okay.
sure that there's good liaisoning between what's conversations happening at the board level with Heartland and the county. Does
Sure.
that allow for some more flexibility?
I believe that is fine. I think we didn't understand that was the intent when you asked that question, that it was not going to be a board member that would be voting, but that would be just there to observe and potentially provide feedback or, just to observe the process and engagement of the board. So I feel confident that I can say that it would be allowable and should be fine.
Yeah, just to clarify, I don't think we ever thought, that we'd have a voting role, but the ability to
Got
sort
it.
of ask questions, participate in discussion,
Sure.
those kinds of things
Yeah.
is generally in what we've done this with other boards that we funded, as Commissioner Kelly has mentioned.
Yeah.
So is to just provide a liaison relationship.
I think that is fine.
Okay.
I certainly don't have a problem with that. And I don't think that any of our board members would take issue with that.
This is Commissioner Reed. I just want to add one point of clarification. So in that, how many members is your board currently? Sorry if I just missed that.
That's okay. We currently have 10 members.
Okay. So we're not talking about filling an open seat, because you mentioned some open seats. This would be just adding an
Yes.
additional member. So I just want to be sure that that's understood.
Yes, that's clear now. It was not clear before
Yeah.
tonight. So understood.
Are we okay on that one? I want to check with Commissioner Portillo, see if she, because I could ask a little different question.
I'm good. Please go ahead, Commissioner Kelly.
I'm looking at the bottom of page 5, and I may have missed something. I might just not understand it. And it says, it was talking about legal counsel is particularly concerned that board members use this mechanism of communication as an appropriate way to get information from the community and share feedback with the full board. It sounds like they're thinking that would be good. Am I understanding? Or are they, I don't think I quite understood the concern.
The concern, I think, is that ensuring that we have clear policies and procedures in place for our board members, that they understand the use of this email, and that when they might receive an email from someone from the public, that they need to act as a board, not as an individual. And so because there aren't any other federally qualified health centers in the state of Kansas, we checked that have this requirement, or that, you know, have their board members with direct contact email addresses listed on their website. There just really hasn't been another model for us to adapt. And so, you know, before we just implemented something, we needed to make sure that we knew exactly what the risks were, and develop some policies and procedures around that to ensure that it was used properly.
I just want to say I appreciate the thoughtfulness about it, and thinking, it sounds like you're trying to get to that space,
Definitely.
and just being thoughtful. I think good board training is essential, and it sounds like you're moving towards that. So I appreciate that.
If I could follow up on that piece, I guess I just want to be clear, because it's stated in there that no other nonprofit organization that Douglas County funds has their boards of directors with emails on their website. And I know that's not the case. So I mean, what we're looking for here is transparency and who is governing Heartland.
Sure.
So talk to us about if there are concerns about how that is, how you can promote transparency in that process.
Well, I think that it's important that if there are concerns from the public, that those are addressed, and that they're addressed by the governing body, which is our board. So those concerns need to be brought to a board meeting where it can be discussed.
So is that on your website in terms of like how they can, if they have to, when your board meeting meets and when they can come?
No.
Okay. I mean, that's what I'm trying to get at, is how do we promote transparency?
Yeah. Yep.
Yeah.
That is not currently on the website. That is something we could consider adding. And when we add board members and their email addresses to the website, we will have some clear language about the purpose of having board members listed and their contact information, and what board members can and cannot provide. Obviously, they're not medical professionals, so it needs to be explicitly clear that they can't provide medical advice, things like that. So there were just some legal things that we needed to consider, and we're still in the process of working out those details on how to do this the right way, so that people have access and can share concerns if they exist, and that our board can address them properly.
This is Commissioner Reed. I want to say on this particular piece of things that, I mean, as somebody who works at a nonprofit now and has worked in nonprofits for my career, I do think that it's certainly standard practice in my experience to have board member names listed. However, I would agree that I think it's uncommon to have particular contact information, individual contact information in particular. And I will acknowledge that I haven't done a thorough inventory of all local nonprofits, but you know, checking out a few of them or being familiar with some of the websites, I would agree that it's standard to have just the names listed. But I think that this conversation for transparency, was born from a community member's particular concern about not being able to locate information about who was on the board in order to reach out to the board as a community member and patient with particular concerns. And so I just want to be candid about where that I think the initial question came from. And for me, it's prompted me to consider of all nonprofit boards, is there a universal one email or some type of contact mechanism that does not necessarily go through the staff for the purposes of both staff within that agency, understanding at least one point of contact for how to address potential grievances or concerns, as well as the public transparency. So I think that it is, that it probably is kind of wrought with some potential legal issues and also some logistical issues for individual contact information to be listed, in my opinion. But I think it raises an interesting question community-wide about, should it be standard practice to have a singular email address, a point of contact that all board members while serving have access to, that is a place to receive information that is not funneled through staff to the board, and that is an important opportunity for accountability. So I just want to acknowledge that it's a question I'm asking myself about all social service agencies and agencies that are like yours and like ours that are accountable to the public for those public dollars.
Yeah, and I can appreciate that. And I do just want to clarify that the way we are proceeding, email addresses for board members that are listed will go directly to the board member. They will not be filtered through staff. Staff won't have access to those. That will go directly to the board. Yeah.
Commissioner Portillo, do you have any additional questions this time? Okay, with that, I will open it up for public comment. Is there anybody here in the commission room that would like to provide public comment on this agenda item? Come on forward. Thanks, Julie.
Sure.
Hey, you're welcome to remove your mask if you're more comfortable while talking at the microphone. It's up to you.
It said I was supposed to sign in. I don't see nothing to sign. Do I have to sign? Y'all know who I am.
You don't need to sign in. I
All
appreciate
right.
you asking. If you could state your name and
I'm
address.
Reverend William A. Doolin, citizen of Lawrence, pastor of church here in the city, and been following this Heartland thing for quite a while. And my concern has always been from the get-go, transparency. When the board, they talk about the board, I had a member of my church that was on the board, and for some reason he was terminated, and he really never got a clarity on why. And he was also a client. I know the 51% that had to be a client. He was a client. So that was my concern. Our concern, when I say our, there's been a committee meeting, has never been about not getting it funded, but we're concerned about who's really running Heartland. What is their hiring and firing criteria? What is really the guideline and power of this board? If the board is made up of clients, is the board autonomous from the staff, or does the staff dictate to the board? This is what I never was really clear on. And maybe it's been made clear, but to my understanding, it's still not clear. If a client has a problem with the staff, can they go to the board for a resolution? Or does the staff tell the board? That's where I'm concerned, because to me, it's still not clear in my mind, and I'm just one person, but my concern is still for the health of the community. When people need help, there should be a place they can go get it. And I appreciate the county supporting it. But at the same time, I think there needs to be some more clarity for the community to know how Heartland is really being guided. If you understand where I'm coming from, that's my concern. Thank you.
Is there anybody else here this evening that has public comment on this item? Please come forward. We are on one topic only. We're talking about Heartland Community Health. And just so you know, Heartland Community Health is what we're discussing. When you come to the microphone, if you can just let us know your name and address or where you live in Douglas County, that'd be great.
Hi, my name is Maria Putt. I live in Lawrence. I graduated from KU years ago, and I just moved back here from LA. I lived in Laguna Beach for about 16 years, and then the last 3 years I was in LA. The reason I'm here tonight is because I've been a holistic healer since 1989, and I've overcome cancer 4 times personally. I've helped many people during COVID overcome COVID holistically. And it's a very simple remedy. The reason I'm here today is not to talk about politics. It's not at all. I'm here because I care about people. I care about humanity. And because I want people here to be inspired with hope and to be able to somehow, whatever your duties are in life, to be able to communicate that to your friends and loved ones. Now, when I said I've helped many people overcome COVID, I have. I've helped one friend of mine's wife who was supposed to have died. She weighs about 350 pounds. She was sick for like 3 weeks in bed with COVID in 2020. And I talked to John and I was like, did you tell her the protocol I gave you? It's real simple, you guys. You might want to jot it down. It's lemons, fresh lemons. So you can go to the store and get fresh lemons. This is how I overcame cancer. It's called The Master Cleanser. And the book came out in 1976. It's not a book, it's a little pamphlet, and it's by Stanley Burroughs. And basically it's lemon water. So if you if you get sick with a cold or flu, or, you can just take lemon juice. So what I do every single day is I'll juice 2 or 3 lemons and put it in a glass of water. I take my D3, 7 to 10,000 IUs a day, and my zinc. That is the protocol. I have a friend that lives in Pakistan. Through Instagram, I know him. His dad died from COVID. I'm like, why didn't you tell me? He didn't know. Then he got it and his mom got it. She was 78. They both took that protocol. We're fine. The woman that I told you was 350 pounds and a good friend of mine's wife that I knew them both because I used to rent from them in Laguna Beach for some time. He gave her the protocol. She was up and out of bed within a week. My cousin is a doctor and he has been vaccinated. He's gotten both of the vaccines because in California, they mandate that. So he's had both of the vaccines and he got COVID because he travels a lot. He got COVID about, I don't know, a couple weeks ago. So after he went to work and he got tested, they sent him home for 5 days. And the first 4 days, he wouldn't listen to me. But then
Maria, I'm sorry to interrupt. Are your comments related to Heartland Community Health Center and the proposal for budget review that we have from that community partner? It's from Heartland Community Health Center.
Well, when I called yesterday, she told me I could come here and talk. I called and talked to I guess it was the city.
Well, you may have spoken with our staff. Thank you for your comments. Our general public comment was at the beginning of our meeting and we have already closed that and moved on to our regular agenda.
Oh, I'm sorry.
That's
Well,
okay.
anyway, I think I got the message out.
Thank you for your time.
And, all the best to everybody.
You as well. Is there anybody else here for for public comment related to Heartland Community Health Center's budget request? Jill, do you see anybody online with their hands raised? Okay, great. I'll bring this back to discussion or any further questions from commissioners.
This is Commissioner Portillo. I do just want to say I appreciate Heartland engaging in this process with us throughout the past 6 months. And I recognize that Heartland is an incredibly important institution within our community, and they provide access to healthcare in a way that's vital to the most vulnerable in our community. I appreciate how engaged the public has been in holding them accountable for the work that they're doing. And I think that there are a number of steps that they're taking now, and I hope a number of steps that they keep taking to focus on that transparency and accountability that not just we as a commission, but the public in general are asking them to do. So I would feel comfortable moving forward with restoring this funding to Heartland, moving forward with this funding request. But I hope that we can continue the conversation about accountability and transparency moving forward.
Julie, I have one more question for you. So I appreciate the patient grievance policy that's in there. That was something that we discussed at our last meeting, and I appreciate Reverend Doolin drawing our attention to it.
Sure.
Can you provide some clarity? I can see both benefits to grievances going to the board and going around staff, but I can also see a reason for it to go to staff first and then to the board. Can you sort of clarify and give us some direction on where you think that's going with your organization?
Well, I think as outlined in the grievance policy that we provided to you, we do have some clear steps. And if there is not resolution, ultimately the board does get involved. And I think that it's important that this process starts at the health center, because that's where the majority of issues can be resolved. The majority of issues are resolved by our staff, our providers, our front desk. And if every complaint went to the board, I think that would be overwhelming. So we recognize that there needs to be transparency, and that there needs to be a way for community members, maybe who are or aren't patients, to have access to the board. And I hope that providing email addresses and that direct contact for folks will help remedy that issue. But I think for patient grievance, we have a process, and it works very well.
Thank you.
This is Commissioner Reed. Julie, thank you for all of that, and to staff from Heartland who are here this evening, and board members who may be with us online and who I know have joined this discussion before with us here. I want to echo Commissioner Portillo's comments and appreciate your participation and engagement in the process and the questions. And for me, personally, I think that it was a really important exercise in community accountability and a bit of transparency around questions that were being raised in various venues and in various conversations. And I think that it was an important conversation for us to have in this public forum. And I hope that it has felt meaningful to you all, and that it strengthens our relationship. And I wholeheartedly believe in Heartland's place in our community in Douglas County. And as a service provider, have known so many clients and friends who have benefited from your services and who really rely on the integrated approach that you all have worked to build. And so I really appreciate and respect that model. And I'm looking forward to seeing how Heartland grows and builds more integrated care into this community. So I just thank you again for participating in the process and for really giving us some tangible responses to some of the questions raised through the community and through us.
Yeah, I'd echo the same. I think one of the key things as we move towards motion and votes here is it is a community partner budget allocation, and that has two keywords in there, and one is community, and we've seen our community engage in that, and we as commissioners represent that community. And so when concerns are raised to us, I take it as a very serious responsibility to bring those to our partner. and say, talk to us about how this is working. And so I think that's what we did in this case. We honored that. And I appreciate the responsiveness of Heartland. I think we still have work to do. And it seems like listening and reading the information that you provided, seems you recognize that there is still work to do and you have plans to do that work. And I'm excited that community members have been engaged in talking to us and talking to Heartland about how maybe they might want to adjust their practice so that we can be more inclusive of the entire community and more transparent. So I'm happy, if it's okay with other commissioners, to make a motion to grant the 2022 community partner budget allocation for Heartland Community Health Center in the amount of $227,003.
This is Commissioner Portillo. I second.
All those in favor? Aye.
Aye.
Okay, thank you all again for joining us. We will move on to item 4.2, the Planning Department to consider a text amendment to the City of Lawrence Code, Chapter 20, regarding plating requirements.
Thanks, Commissioners. Catherine Week from Metropolitan Planning Organization is moving into the panel. Catherine, we'll turn it over to you.
Good evening, Commissioners. Catherine Week, one of the planners in the Planning Department. So I have before you tonight, it's a joint ordinance resolution for a text amendment, and kind of one that planning staff sees as kind of a housekeeping type text amendment. The reason it's before you this evening is because the subdivision regulations are a joint regulatory ordinance / resolution by both the city and the county. And although this particular text amendment is only dealing with plating actions or clarifying plating actions within the city limits, it still has to come before the Board of County Commissioners for approval, recommending the change. So what this plating text amendment does, or the clarification in the text amendment does, is planning staff was getting a lot of inquiries about property that was partially platted or adjacent to right-of-way that had been vacated, and the language in the code was not particularly clear about whether or not these properties with these types of situations would be required to plat to get a building permit within the city limits. So what this text amendment does is clarify the language for when platting is required to receive a building permit. It deals with 8 sections in the code in 2801, 2808, and 2813. And 2801 exempts building permits for things such as life safety or minimum habitability. So if you have to like replace your sewer line or something that you need for basic life safety reasons, that would not trigger a platting action, even though you are requesting a building permit. You can still get that building permit without having to plat. And then that also clarifies that in 813, similar language clarifying that you do not need to be a lot of record or non-conforming lot if you're getting a building permit for those life safety type issues. You would not have to plat. It also clarifies in situations that I mentioned where perhaps a platted lot has acquired some additional property adjacent to it, or right-of-way has been vacated that is not platted, and they now own that portion of vacated right-of-way. They would not have to go through a full plat process. They could utilize the abbreviated platting process, which is the minor subdivision, which simplifies that action. If they were to pull a building permit that does trigger the platting action, they could do that through the minor subdivision process for those partially platted type properties. So that is basically what this text amendment does. There's minimal changes to the rest of the section. It's just that clarifying language. I would be happy to stand for any questions if you have them, and clarify anything if I need to.
Thank you for that presentation. Do you have any questions from commissioners?
I don't have any questions.
I don't have any questions either. With that, we'll open it to public comment on this item. Anybody in the commission room who would like to come provide comment? Well, you can come to the microphone and you can ask your question. We do not generally respond directly, but we'll bring it back to discussion.
But I'm also into real estate investing. So my question is, if you buy a piece of property somewhere in Lawrence and it's meant to be built on, you can build land, you can build, say, houses on it and stuff. Then when you go to, how does it go? Like, let's say you buy 40 acres and you want to subdivide it for houses. I'm working with an investor who's building houses. Can you maybe expand on that a little bit for me, please?
Is that a question for staff?
Yeah, okay, thank you.
So this particular text amendment doesn't deal with that particular instance. So if it's undeveloped property in the city limits for subdividing into residential lots, like 40 acres, and if it's not already platted, it would be required to go through a platting process for development. And this particular clarification does not change any regulations related to that. This particular text amendment only clarifies instances where the code was ambiguous about life safety type building permits and partially platted properties such as adjacent to vacated right of way or small strips of land that have been acquired next to an already platted property that wants to be incorporated into that lot. Hopefully that clarifies that a little bit.
Thank you. This Commissioner Reed, thank you for taking the time to answer that and clarify. Do we have any other public comment related to this agenda item? Online, Jill, anybody? No? Okay. With that, I'll bring it back to discussion amongst commissioners. Any further thoughts?
I don't have any thoughts. I'd be glad to make a motion.
Please do. Thank you.
I move that we approve text amendment TA 20-00003 to the City of Lawrence Code, Chapter 20, regarding the platting requirements in the City of Lawrence, and approve joint county resolution ordinance number 9807.
This is Commissioner Portillo. I second.
All those in favor say aye.
Aye.
Aye. Okay, and with that, we'll move on to appointments. Do we have any this evening? I don't believe so.
I don't believe I know, I think we're working on a couple, but I don't think I have any to forward on at this point.
Okay, thank you. And so how about miscellaneous items? Anything for us, Sarah?
Yes, commissioners, you've got a memo in the packet for me. I do want to point out that upcoming in the next couple of weeks are the Kansas Association of Counties 2022 Local Government Day. And there's also an inaugural county 2022 County Day event specifically, so local government and county. So if you're interested, there's registration information, and obviously Robin can help you get registered if that's what something you want to do. And we've also just got a number of follow-up items attached from our different boards. What the Douglas County Historical Society and the Health Board packet, but also there's the first legislative policy update from our intergovernmental relations firm, Little Government Relations, is also attached. That's all I have, commissioners.
This is Commissioner Reed, and thanks for that, Sarah. I will go ahead and mention that I plan to attend the local government day on January 26th. My afternoon opened up, so I believe if any other commissioner is planning to attend, we can public notice that.
I'll be there.
Unfortunately, I will not be able to attend.
But we'll go ahead and get it listed for our open meetings, and we'll get it listed.
Thanks. Any miscellaneous items from other commissioners? Seeing none. I believe that brings us to the end of our meeting. So, have a good evening, everybody. Thank you.